Hello, everyone. Today we have Dr. Hashmi and Dr. Mirza. They are both very experienced in the field of medicine. Dr. Hashmi is an experienced psychiatrist with years of experience, and Dr. Mirza is a general practitioner with multiple years of experience as well. And today we'll be discussing the topic of neurodiversity. And my first question would be for Dr. Hashmi to explain what neurodiversity is.
Means basically no two people are the same. We all are neurodiverse in our own way, but we call it a condition or an inconvenience in life when neurodiversity is expressed in way of ADHD and ASD. ADHD is attention deficit and hyperactivity disorder. ASD is autistic spectrum disorder. They both are huge conditions in their own rights. Hence, we can pick one to discuss today, and we will make another video to discuss the other condition, which is autistic spectrum disorder. So if you are happy, we can proceed with attention deficit and hyperactivity disorder.
Right, that's correct.
Yeah, sure.
Basically, as the name says, it is a condition for attention deficit and hyperactivity. Now, how this works? The pathology is very simple. There is less dopamine in certain parts of the brain, and you need to increase dopamine. How it is expressed? The reason I'm talking to you is when this condition is severe, it is usually picked up in primary or secondary school. Children most often hit the crisis at the time of GCSEs or A levels, when they struggle to maintain concentration to perform at the best of their abilities. But a lot of times they don't realize that it's attention deficit and hyperactivity until they get to the university. Now the disorder is presented differently in men and women. And that's very important to understand, because for years it's been presumed that it is only the disorder for the naughty boys and overlooked. So completely it was overlooked by the clinicians at that time that it could ever happen in girls. One thing. Number two is that it is associated, a lot of times still in schools, it is associated with bad behavior, which is not the case. It is a condition which is 100% manageable. Now in boys, especially focusing at university years, is what they are going to experience when they start their university, 18, 19 years old. Yeah. The first thing they will actually experience or hit the crisis is disorganization. They won't be able to bring an organization to the day. Why? Before then, they were living in their family home with their parents, and the parents were actually compensating for their organization. So the first thing they're going to hit, they will be completely disorganized in their day. Secondly, memory issues. Now, when you look at the memory problems, you take it as an umbrella. It is not an umbrella. What you see typically in attention deficit and hyperactivity disorder is memory for the events is perfectly fine. Memory for the procedural information, driving a car, riding a bike, is perfectly fine with no issues. Memory for day-to-day affairs, management, is difficult to retain. Why? The mind is very busy. It's an overactive mind. They get thousands and thousands of thoughts at the same time, unable to think any thought through. So it's a very busy mind. And because the thoughts are so interfering, they forget. They forget important obligations, appointments, and they forget their own personal things. Where they have kept the phone, their wallet is always missing, their bus card is gone, their university card is lost. Every day, every week, they are losing things. If you track back to their school years, these are the boys and the girls who actually left their personal stuff in the classroom, not brought them home. Yeah. So forgetfulness for the daily things, for losing items all the same time, at the same time, feeling anxious, feeling misfit, and to compensate their anxieties and to compensate their feelings of being misfit, they overcompensate by playing clown.
What does that mean?
That means they are going to do funny things.
Oh,
They are going to do funny things. They are easily led.
so it
So if
means
somebody
that,
says to them, climb on the tree and hang upside down so that I can take a picture of you, it'll be a good laugh, they'll do it. For social acceptance, there will be an impulsiveness, an eager to be accepted, an eagerness to be accepted, and they will not think the consequences of the events. So they will take impulsive actions. They are generally always on the go as they are rushed in doing things. They will impulsively get themselves involved into multiple activities the moment they'll enter the university and not being able to do anything on time. They procrastinate. They can sit 2 hours with all the right emotions, with all the right intentions, with all the planning to do things, but not being able to initiate a task. And even at the last minute, I call them lastminute.com. Why? Because everything got to be done at the last minute. They will never be able to plan anything. They are the ones who are going to prepare for the exams whilst in the train to the examination center.
so when you say there is a memory problem and their memory is affected to do day-to-day activity, does it affect their examination?
Exactly. So what will happen is there is so much influx of thoughts that they can't really retain any information. They are going to read and read and read again, still they forget. They feel as they are reading it the very first time. Their examination results are usually less than their potential. Their positive things are they're always very bright. They are bright, super intelligent, very creative, and a very strong visual learner. But they will have poor handwriting. They are not always very coordinated, although will involve in many sports.
So if they are not able to retain the information and the memory is not as good as it should be, so with the present modern or whatever you call the system we have got, which is cramming system, so they are poor performers then?
They are very poor performers, and in university years, they would actually require time offs. They fail the exams. There will be resits. There will be assignments always late, asking for extra time to submit their assignments, performing at the less level of their abilities. Everybody would say to them that you are so intelligent. You can do wonders if you put your mind to it, but they are never able to put their minds to it. But a lot of times they do achieve large and big qualifications and achieve good positions. I have met individuals with attention deficit and hyperactivity who actually are successful artists, writers, solicitors, barristers, even working for aerospace. engineering. So they are very able. Now there are 2-3 things I must say. Number one, in girls, it is not properly diagnosed, rather overlooked. For many years been overlooked, and I tell you how it presents in girls in a minute. Secondly, there is a cultural expectations. So number one, if you don't have a diagnosis, you are struggling, no one is sitting in anyone's mind. So parents even wouldn't know that they are struggling. Yeah. Number two, because of the cultural pressure in some parts of the world where Britain is a multi-ethnic, multicultural society, we get people from everywhere in the world. And some cultures actually put so much pressure on their children to perform at a high level that they have no other choice except to put their 120% to achieve less than 50% what anybody else would achieve with no effort. So they managed to, so achievement of qualification, the oldest and the most qualified patient I came across in ADHD was a 72 years old woman with a PhD degree.
Oh.
But it was all depends on the way they end in managing their day in a military style fashion to get things done. Now, one thing which is very inherent is they will struggle falling into sleep. So initial insomnia, what we call it technically, they'll go to bed and they'll take at least 2 hours, at least 1.5 hours to calm their mind down to fall into sleep. That is one of the typical signs of them. Yeah. Secondly, they have to really work hard, use their visual skills because they're visual learners. So my advice to them is that if they struggle retaining information, use visual cues, transform text into some kind of a plan, some kind of a chart, or use multiple color markers to highlight. So when they sit in the exam, the page actually, what they are reading or the chart they have made, a flow chart for the information, will come in their mind as a photograph. They might not understand the concept behind it because comprehension is an issue, but they will be able to reproduce the information as expected. Usually these children, these adults, usually they are diagnosed with dyslexia when they were little, and there is some correlation of ADHD with celiac disease. So if you ask them, they might present you with some irritable bowel syndromes, some food sensitivities. I can't eat this, I can't eat that. I have to be very careful about my stomach because my stomach is a bit weak.
Why is that?
For some reason, I think most individuals with ADHD, I actually refer them to their doctors for celiac disease investigation.
Is there any hormonal link? Because celiac is a deficiency is due to gluten sensitivity,
Yeah.
and then you lose your villi and the absorption is gone. So
Yeah, there is some link. Obviously, you are the GP. So, Dr. Mirza, you would know the aspect of the link better than me as a psychiatrist.
So this brings in an interesting discussion around the wheat, because
yes,
they are saying that wheat is genetically engineered for the last 50 years, and it is the root cause of insulin resistance, which is causing diabetes and stuff. And it causes insulin resistance, then is now they're calling Alzheimer's as type 3 diabetic.
Wonderful.
So,
Yeah.
so might be that reason which needs to be explored further, I think. We haven't got I haven't got any scientific evidence with me at the moment, but yeah, that is interesting.
Can you explain briefly what the disease you just said was? Celiac disease.
So celiac disease is a gluten sensitivity, where a patient or an individual cannot eat wheat, which has got gluten. So if they eat lots of gluten, they get diarrhea and loose stools, and they start losing weight and everything. So what happens is that there is a villi in the small intestine which absorbs. That villi are destroyed in celiac disease. So if they stop wheat, the villi regrows and you go back to normal, and that absorption and diarrhea and vomiting and everything is gone. So that is related to wheat directly.
Okay. And then, Dr. Hashmi, how would you suggest that these people with ADHD manage their day if they have all these different difficulties that they face?
That's very, very clever question. The first thing is they are commonly misdiagnosed with anxiety and depression. Less for depression, but we can't rule out depression because usually they are diagnosed because they struggle with sleep. So the first thing GP thinks is linked with depression. Secondly, anxiety, because they are so anxious not being able to put an organization in their day and struggle to retain information. So they are most commonly given antidepressants, which don't bring any difference. So they will move from or switch from one antidepressant to another. When it comes to you abusing illicit substances, you will see that their choice of drugs would be a stimulant medication, amphetamines, cocaine, ecstasy, because they are the stimulant medication. They're meant to increase dopamine in certain parts of the brain. So basically, they will say that they take these drugs not for pleasure, rather to feel normal. They will actually help themselves in treatment by taking drugs, but they were actually, the current system rubber stamp them as being involved in drugs and then send them to drug services. When you investigate further, you will find out history of anxiety dating back to school years. Yeah, they were excluded, seen as naughty, bad influence, clown in the class, clown of the school, clown of the class. Yeah, poor performance. Everybody thought they are just not good at academics, but they did manage to plot through their way to the university. And that's where they ended in taking illicit substances to self-treat, because that's the only way they could survive a day, unable to put organization in their life, procrastinate, a total disruption. Yeah. Now, I would suggest they actually go online. There are plenty of forums and plenty of tools online. The most reliable is UK Adult ADHD Network, which is UCAN, UKAAN, UK Adult ADHD Network. It does provide a lot of information on ADHD. Fill any specific tool or ask the GP to just give them a specific screening tool, and you will see, they will straight away, you will see problems. What is the difference between girls and boys? Boys tends to jump around. They are physically more active. Girls are not. And hyperactivity doesn't necessarily present as hyperactivity. It presents as mannerisms. You will see an inner need for constant movement. They will not be able to sit and watch a television program in one sitting. They got to do 2-3 things at the same time. So they are watching television, playing on their mobile, and their feet are actually moving their feet.
Like
Yeah,
me then.
probably.
Like me.
Yeah. Then what else you will see is mannerism. They'll play with their hair. Girls play with their hair. Piece of jewelry, handband, pen, eating pen all the time, playing with something got to fiddle. They got to move. They got to move their hands. They won't be able to sit for the whole lecture. They just zones out in their own world. And they fear that they are put in the center of attention when somebody asks them question. And then, yeah.
It was interesting to noticed that it is very common in adults, because
It is.
we, as when we were medical students, we were taught in the psychiatry that ADHD is a disease of the young, and we never had this ADHD diagnosis in adults.
You know, you have said such a wonderful, hit the nail on the head. 1999, I attended World Congress in Psychiatry as a junior psychiatrist in Hamburg. And that was my first introduction to ADHD throughout life. Now, when I came back after that training and I spoke to my consultant, who happens to still working in the NHS post-retirement, and I asked him and told him about ADHD throughout life, he said to me, it is an American gimmick for insurance purposes. For years and years, we believed that some children are naughty and that's it. Then we believed that, yes, attention deficit and hyperactivity is there, but it's not going to last forever. Children grow out of it. I know that is what exactly I was taught to start with. Since 1999, August 1999, I've been working in neurodiversity, specifically on ADHD. And I have seen it across, it's a throughout life. It's a misnomer that it goes away. It's a genetic contribution. Children who are diagnosed with ADHD, their parents, at least one parent, there is a genetic link now established within families, there is ADHD.
Right. So the treatment
very simple.
Is the
very
same?
simple. Oh no, very, very simple. The first line of treatment is I am going to suggest few gadgets which will help them. Number one, if sleep is an issue, I've been advocating for years to use amber glasses. Amber color glasses, and I'll show you actually a picture on my mobile on amber color glasses. And what do they do? Actually, I've been actually suggesting this for years. I've been actually asking, and I have hardly come across anyone who has not been benefited. I'm not promoting anything. I have nothing and no interest in amber glasses sale or no sale or any types of it. I just do it because of clinical interest.
Right.
Amber color glasses. Yeah.
Yes.
Now, what these glasses do? These glasses blocks the blue light in a way that activates pineal gland. Now, pineal gland in our brains secrete melatonin. And the melatonin is responsible for sleep. So instead of taking tablet melatonin, which is going to shut down your system naturally, my advice is buy a pair of amber glasses or whatever choice you like. I have no personal interest in recommending that, but wear them for half an hour every night for 4 to 6 weeks. You will see instant results, and you make sure that your pineal gland learns to secrete right quantity of melatonin at the right time. So put you in sleep. Your initial insomnia will go, your sleep will be more peaceful, and your sleep-wake cycle and your stabilized, not only stabilized, rather regularized for permanent. Continue using it as long as you need it.
When you say wear this orange color?
Orange, amber color glasses. Amber color glasses to block blue light.
What time do we
just
have
half an hour before bedtime? Half an hour before bedtime.
So you should be awake when you're wearing, and you
yeah. But when in 15-20 minutes you will start yawning. Trust you me. Wow. You go to bed, you take the glasses off, and just fall asleep.
I just had one question. So, did you mention the girls' differences between boys? You said that they were hyperactive, but not necessarily physically.
Yes, mentally hyperactive, psychologically hyperactive, distractibility will be the same, but their hyperactivity will be presented as mannerisms. Now, one thing especially I must add is the relationship with food. In ADHD, you will see grazing. You will see eating almost, if you put a bowl full of nuts in front of the person with ADHD, the person cannot stop putting the nuts in their mouth until the ball finishes. Why? It's an expression of hyperactivity. In eating disorder service, and I've been beating this drum for a long time, in eating disorder services, these patients are wrongly diagnosed with atypical bulimia not otherwise classified, not otherwise diagnosed. It's all range of eating disorders. And there is a bias between girls and the boys. I have two siblings, brother and a sister. Both are my patients. Both have typical ADHD. Both are under treatment. Girl and boy, both boy and girl, brother and sister, has similar relationship with food. Yeah, girl is diagnosed with atypical bulimia, boy is not. Yeah. Now, once the proper treatment is started, trust you me, this constant eating habit disappears.
This brings me to the question. So they're eating, so are they fat? And number one. Number two,
anything.
They can be. Number two, but I think this is the very important part of your video, which we put somewhere in the start. Diane can do that. Just remind your viewer that what are the conditions, mental health condition, which are misdiagnosed rather than ADHD. So the people who are suffering from those conditions and hasn't been able to get better.
Every day of my clinical practice, I spend hours with neurodiverse individuals. Yeah. Commonly misdiagnosed, anxiety is most common.
One.
Depression is second. Emotionally unstable personality disorder, EUPD, or borderline personality disorder is the third one. Mind you, EUPD is a dumping ground in psychiatry. When you don't understand anything, psychiatrists just put it down in EUPD box and don't think back. You know, the problem with mental health disorders services in Britain is that once whatever the status of the practitioner is, once the diagnosis is made and rubber stamped, nobody goes back and reverse that diagnosis. Nobody looks back and say that the diagnosis was not made correctly. Yeah. It just continues. You live with that diagnosis, even with the patient is saying, I don't have those symptoms.
That's a shame. And it's, in a way, it's sad as well.
You know, for over a decade, I've been saying this in different forums, that the day neurodiversity actually hit the NHS, we will never have the resources to deal with it. And that's exactly what we are seeing now. These lockdowns made people to think about themselves when they never had the opportunity to think. I have individuals who said, doctor, I have always done things like this, that I have put one shoe on and I rush to make a cup of tea, and then I rush to put the dirty linen washing in the washer, and then went back to put the another socks, and then back on cup of tea. This is a typical ADHD behavior in a house. And he said, I never realized there's something wrong with it until the lockdown. And I had the chance to reflect and think about what I've been doing.
So I'm just conscious about your time. You've got a very busy clinic coming up. So you've given us 4 diagnoses. So anxiety, depression, emotional unstable personality disorder, and the 4th one was
eating disorder.
Eating disorder.
Eating disorder. Now, especially bulimia nervosa, not otherwise classified. I want to give another tip. In ADHD, if your handwriting is bad, use a chunky pen, because sometimes the small muscles in the hand are not so quick. So holding this standard pen can be painful. Just pick a chunky pen and it will be more easy. Number 2, when you get a topic to do something like writing an assignment or talk about something, you get a lot of thoughts. In ADHD mind get loads of thoughts in that. Yeah, I suggest use your iPhone, record it, because you miss it. Then when you sit on writing on the topic, you will see your mind is empty, not coming up with anything. If you have recorded your thoughts, just listen to yourself, type it up, and then correct the grammar and other things. The last thing I want to tell you, which will help the patients, is foot massage slippers. I suggest them routinely to individuals. Why? In ADHD, there is a high sensory need. And if you are not going to satisfy the sensory needs, you are going to be distracted by every stimuli around you. And you need a parallel activity to undertake an activity, like the music must be switched on for me to read an email. Now, wearing foot massage slippers will give you sensations under your feet. And those sensations going to satisfy your sensory needs. You are less distracted, more focused, and you will be less in need for a parallel activity to undertake an activity. So you must use amber glasses, must use foot massage slippers, and a chunky pen to write.
So I just didn't get the chunky pen bit. What will it make?
What happens is this pen makes their hand to hurt, and the grip is not brilliant.
So patient who are suffering from ADHD.
Yes.
And with the
it's both in neurodiversity, in ADHD and ASD. We'll talk about it again when we talk about autistic spectrum. But what happens is their handwriting is small. They'll put more pressure on a sheet of paper. Yeah. And their hand will hurt. So what happens is if they use a chunky pen, a big pen, it'll be much more comfortable for them to hold and write.
All right. I think Diane is going to wrap it up.
Yeah, so that was a lot of good points. We basically covered the different things that can be misdiagnosed instead of ADHD, the potential treatment options that you can use to deal with a day-to-day basis, how to make your life a little bit easier. And I think that next time we'll discuss the different treatments or and diagnoses in ASD.
No, I was thinking there are some aspects of the treatment of ADHD are left on this occasion. So let's do the next video on the treatment of ADHD, so I can discuss the amphetamine and non-amphetamine based compounds which are usually prescribed, so people know what they are going to get as a part of the treatment and the possible recovery, how quickly they can recover with the condition.
As soon as you get some time in your diary, busy diary, let Diane know. I think he will arrange the meeting.
Of course we will. Looking forward to talk about neurodiversity in our next video.
Anything else, Diane, left?
Nothing else. I think just next time maybe we'll preface like the hormonal thing about what's going on here, like the dopamine levels, as in if it's less or more, and that exact thing. I think that will be interesting for people to understand.
Okay. Thank you.
Thank you very much.
Thank you very much.
Thank you.